Welcome, everybody. My name's Ken Madden. I'm the North American Chair for the International Association of Gerontology and Geriatrics, and I'm a geriatric medicine specialist at Vancouver General Hospital. I'd like to welcome everyone to the Stand Up for Rights of Older Persons, a call for action. Every day, I repeatedly witness as my older adult patients' rights are violated through a combination of both ageism and ableism, even prior to the current global pandemic that devastated the older adult population. In my view, the COVID-19 pandemic merely amplified issues that were present before. And these are issues that often intersect and amplify inequities and other identity groups. Just as a few examples, social isolation was an epidemic prior to the pandemic. 15% of North Americans live alone, 10% express issues with loneliness. And during the pandemic, we essentially quarantined all older adults in their homes, and adults in residential care were locked in their rooms. So what was previously a crisis is now verging on a catastrophe. Speaking of long-term care, 8% of older adults live in collective dwellings, and there's a large body of research indicating the poor quality care in these facilities. Unfortunately, the staff are essential, but they're undervalued, and they're very poorly paid, and they're forced to work at multiple sites due to a lack of a living wage. This moving back and forth has long been identified as a possible vector for disease. And of course, during the pandemic, this moving back and forth between facilities resulted in a collapse of long-term facilities across North America, actually requiring military intervention in Canada. Another issue in North America is a lack of intergenerational solidarity and ageism. Unfortunately, North Americans are very uncomfortable with mortality and illness. Often sickness is seen as a sign of guilt, and health is a sign of some sort of vindication. When older adults are reported in the media at all, there aren't people who need our help, there are people that are overwhelming the system. And I think this got much worse during the COVID-19 pandemic. Often, instead of referring to our sick neighbors or sick friends and sick family, derogatory terms were used. The victims were only older persons with comorbidities. Also, the discussion I found during the pandemic was, will older adults overwhelm the system, instead of reporting on why was our system so fragile in the first place. I mean, older adults aren't failing our system by getting sick, we're failing older adults. And there's often a false dichotomy, and this got worse during the pandemic, between saving lives and saving the economy. There was this really disturbing narrative that if older adults would just isolate, we could get back to normal, as if having a huge proportion of the population isolating is anywhere remotely normal. So these are just three examples. I think the panel will discuss many more. Although this amplification of issues poses challenges over the next decade, I think it also provides an opportunity to address long neglected inequities and to stand up for the rights of older persons. The United Nations Decade of Healthy Aging started in 2021, and it provides a specific opportunity to advocate for a convention on the human rights of older persons, and this is why you're invited here today. Now, I come from the medical field. I'd never heard of the term convention. Probably most of the people here do. A convention is just a term for a legally binding document. Now, if we can get as many organizations as possible in the US and Canada involved, the UN Decade of Healthy Aging, I think, is a unique opportunity to make the case for this convention. So today, I'm privileged to both introduce and hear from a number of speakers who outline what is the current state of the rights of older adults in North America, and why we feel this is an ongoing and worsening crisis, and what can the United States and Canada do specifically to promote human rights for older adults by advocating for a UN convention. Now, to be completely upfront at the start of the program, what do we want? At the end of the program, there's going to be a QR code you can scan that'll take you to a document to sign. We would really like your organizations to sign on to a call for action to the UN to have a convention on the rights of older adults, to give older adults the basic right to age with dignity. We'll also have a question and answer period at the end, so just put your questions to the chat and we will answer them at the end. So I'd like to introduce some of our speakers. Everyone hates long intros, so everyone's complete bio is going to just be put in the chat. Our first speaker is Dr. Kieran Ribeiro, who's going to discuss the current state of older adults' rights. He's the chair of the steering group for the Global Alliance for the Rights of Older Persons.
Thank you very much, Ken, and thank you very much to the organizers of this event for inviting me and including Gareth on the agenda today. I'm going to spend a few minutes talking to you about what a UN convention is, why we need a UN convention, and what it will do for older persons. The World Health Organization's Global Report on Ageism, published in March 2021, states that 1 out of every 2 people globally are ageist against older people. The COVID-19 pandemic, combined with extensively entrenched societal ageism, has created a dual pandemic. The result has been a widespread and devastating impact, laying bare decades of human rights violations against older people in Canada, the United States, and globally. According to the United Nations Universal Declaration of Human Rights, created on December 10th, 1948, quote, "All human beings are born free and equal with inherent worth and dignity." Clearly, this truth does not meet the reality test for older persons. While the UDHR is an ideal standard held in common by many nations around the world, it bears no force of law. International human rights law and mechanisms are needed to enforce its implementation. Covenants and conventions are put in place to prevent and prohibit specific abuses and to protect specific vulnerable populations. International human rights laws lays down obligations which states are bound to respect. These are not new. They include racial discrimination in 1969, economic, social, and cultural rights, 1976, civil and political rights, 1976, discrimination against women, 1979, torture, Committee Against Torture, 1987, rights of the child in 1990, migrant workers, 2003, torture and other cruel, inhuman, or degrading treatment or punishment, 2006, persons with disabilities, 2008, and enforced disappearances in 2010. By becoming party to these international treaties, states assume obligations and duties under international law to respect, to protect, and to fulfill human rights, and they must refrain from interfering with or curtailing the enjoyment of human rights, protect individuals and groups against human right abuses, take positive action to facilitate the enjoyment of basic human rights, undertake to put into place domestic measures and legislation compatible with their treaty obligations and duties. Every state that is party to a treaty or a convention has an obligation to take steps to ensure that everyone in the state can enjoy these rights set out in the treaty. Where domestic legal proceedings fail to address human rights abuses, mechanisms and procedures for individual complaints or communications are available at the regional as well as the international level to help ensure that international human rights standards are indeed respected, implemented, and enforced at the local level. Monitoring the core international human rights treaties is currently done by 10 human rights treaty bodies, which are committees of independent experts elected by state parties that monitor implementation of the core human rights treaties. So let's turn our attention to what would a UN convention do on the rights of older persons? Well, first, they will combat ageism and protect human rights of older people. This would provide a universal framework with an ethical, moral, and legal lens to scrutinize all policies, all procedures, theories, programs, laws, and to ensure culpability and surveillance, obliging states to adopt non-discriminatory laws against older people. It would provide policymaking guides by encouraging the collection of data on older people and to help government to allocate appropriate resources more fairly and for developing policies and programs for the enjoyment of human rights of older persons. It would improve accountability by providing reporting and mechanisms for states' actions towards older people and would provide redress systems for violations of these rights. They have been proven effective. We know that current international law is clearly deficient based on what Ken has said and what we're still observing. and it does not adequately protect older people's rights. It is undeniably clear because of the horrendous experiences we've seen both before, but especially during the COVID-19 pandemic. And above all, there is incontrovertible evidence that exists that United Nations conventions on women, children, persons with disabilities, not to mention the others, are highly effective at positively changing the lives of its recipients. It would also serve to empower and educate the public with the knowledge on how recipients need to be protected. And finally, a UN convention would legally give the right holder status to older people. It would be an anti-discriminatory tool to challenge negative stereotypes and enforce the view of older people as individuals who are knowledgeable, have power, wisdom, and experience. Colleagues, in conclusion, let me start by saying no older person should be left behind. A UN convention could guide the government on ways to protect every older person's rights and inform a basis for policy programming, public awareness, and education. What you permit, you promote. Let us not permit the status quo, and let us use the lives sacrificed by older persons to make a positive change. Canada and the United States has a moral, ethical, and legal obligation to urgently support a UN Convention on the Rights of Older People. Please scan the barcode and sign your name to this campaign. Thank you, Ken, and back to you.
Thank you, Dr. Ribeiro. Our next speaker is Dr. Martha Beal, who is the United Nations representative for the International Association of Gerontology and Geriatrics. And she's going to discuss access to equity and the decade of healthy aging.
Good morning. I'm going to speak about the United States, which prides itself on policies and laws to protect older persons. I'll just take a few areas. Health. While we still don't have universal health coverage for all our citizens, back in 1965, we did launch Medicare, health insurance for older people. Employment. We have laws and policies prohibiting age discrimination in hiring and firing, and we eliminated by law mandatory age retirement. We have specialized housing designated for older persons. However, these policies are widely and quietly, somewhat subtly, subverted, often because of ageism, sometimes in the name of protection of older persons, and other times because older people are simply invisible to policymakers. In health, well, we still see medical providers attributing some symptoms of their patients to, quote, old age, which can lead to overtreatment or undertreatment without consulting older persons on their views, their goals, and their views of the trade-off between benefits and burdens of treatment. And of course, during the pandemic, as Ken referred to, we saw protective isolation of older people in long-term care facilities. Now, this made certain amount of sense to prevent transmission of disease in a congregate facility, but it was at great cost to many older people who didn't see their families for over a year. Employment. Well, we all know somebody who has been, quote, accessed, someone over 55, who has had a very great difficulty in gaining new employment. And this is compounded in the pandemic by older persons' own fears and employers' reluctance to bring on employees that they might risk being held responsible for if they become ill. Housing and other environmental accommodations are growing in availability, but they're underfunded and sometimes designed by experts without consultation with older users. So in short, older persons are too often seen as deserving of charity. Government benefits are a gift which can be withheld in times of tight budgets. Well, we should be seeing them as rights holders who are included in designing the policies and programs that will, in the words of the UN Decade of Healthy Aging, allow them to live the lives they value. A binding legal instrument, a convention in short, would establish older persons as rights holders and strengthen their claims on full implementation of those rights. Thank you.
Thank you, Dr. Beal. Our next speaker is Margaret Gillis. She's the president of the International Longevity Center, and she's going to frame the rights of older persons in Canada in 2021.
Thank you. Thank you very much. Those of us in the field of aging all know that ageism is as old as time itself, and that is one of the most pervasive,
very clear,
and least addressed isms. In the last 18 months, the world saw the devastating and killing effect of ageism as we plunged into an unprecedented global pandemic, which resulted in unspeakable suffering and death, and sadly, the clear and profound violation of human rights, particularly of the old. In my almost 63 years on the planet, I can't recall a time when my country, Canada, was less recognizable, when the principles that Canadians have been raised to take for granted, the right to life, the right to health, and the right to justice, were so clearly and profoundly denied based on age and rooted in ageism. It made me long for the days of garden variety ageism where there wasn't mass deaths in long-term care. Before the pandemic, I would not have believed that the following could actually happen in Canada. The grim statistics. To our national shame, Canada was the worst of the worst, with a death rate in long-term care much higher than that of other developed nations. Older Canadians being denied access to hospitals because they were in long-term care homes and left to die horrific deaths by COVID without acute care. Or frail older persons dying of dehydration and malnutrition, having been completely abandoned in care homes. Critical care protocols in provinces, such as the one we just heard about in Alberta, that state that those over 60 with poor chances of survival be denied admission to ICUs. Imagine that happening to any other group based on race, religion, color, or creed. There was also skyrocketing rates of elder abuse, lack of access to social services, and older Canadians negatively stereotyped and portrayed as a homogeneous group, and on and on. So in this year when older people were devastated by the pandemic, we would have really expected a more robust response from governments around the world, including in Canada. Sadly, we saw only a tepid response, indicating clearly that we need an international protection on the rights of older persons, such as a UN Convention on the Rights of Older Persons. So what have we done in Canada to push for a United Nations Convention on the Rights of Older Persons? We're going to share that with you in the next few moments. First of all, we are building partnerships. We put together an advisor group of 10 influential Canadian NGOs, along with the IFA, and have undertaken work such as the development of a shared election platform document for a federal election, which was held last month. And we're now developing a generic letter for a writing campaign directed at members of Parliament. And we plan on creating a strategic plan to move forward and then fan out to share and involve other NGOs in Canada. We have worked to influence our government to determine where they stand on the issue of convention. At present, Canada is sitting firmly on the fence on the convention, having told us that the door is open without actually having walked through it. They have had this stand since 2018. So let's face it, they've had plenty of time and evidence and for the need to move forward. We see this as a call to action. With countries like ours, that are on the fence or those against the convention, we have used the rights argument to influence their positions. We have written to and visited other political parties to seek their support. And it's critical to make the case at country capitals, like mine in Ottawa, as this is where decisions are made. We are in continual contact with politicians and bureaucrats to make our case for the convention. We have used Twitter and social media for instant updates. In Canada, all political figures have Twitter accounts. Find them in your country, tag them, and make sure that they get all your posts. We have used really key, simple messaging in the tweets. Ill treatment of older persons is a human rights violation, and we need a United Nations Convention on the Rights of Older Persons to respond. We have been hosting seminars, again with NGOs partners, and sent out joint press releases, letters to government, input into federal budgets, asking for funding for older persons, and retweeting and redistributing each other's messages to keep the issue in the public eye. We look for allies like Senator Patricia Bovey, who called for a United Nations Convention on the floor of the Canadian Senate. And we use invitations to speak at parliamentary committees to call for your United Nations Convention on the Rights of Older Persons. And we mention it in every media interview. We use the open-ended working group meeting at the United Nations to push the message, of course. We have statements ready, hosting side events. And besides talking to your capital, contact your UN ambassadors in New York and make sure they know about and are active at the open-ended working group on aging. We had our ambassador, Ambassador Bob Ray, speaking at our side event last year. We really need to be the squeaky wheel. Otherwise, the government sets the agenda, responding to other interest groups who have organized and put pressure on other issues. Let's join together. Let's fight for the rights of older persons, and let's make sure there's never a year like we just witnessed. Let's work for UN Convention on the Rights of Older Persons. Please sign the open statement, stand up for rights, call for action by scanning the barcode. Thank you.
Thank you, Margaret. That was fantastic. Our next speaker is Dr. Cynthia Stewan, who's the chair of the NGO Committee on Aging, and she's going to discuss framing the rights of older persons in the United States in 2021.
Thank you. And especially, it's very easy to come after Margaret to hear, and exciting to hear what Canada has been doing. I won't repeat the rationale that's been highlighted here from every speaker previously, other than to say here in the US, nearly 8 out of 10 deaths from COVID-19 are among the 65 and older population. Also, the World Health Organization reports that 1 in 6 older people have experienced some form of abuse during the pandemic. We all have our horror stories here at home and globally that speak to the violations of human rights of older persons during this pandemic. Canada is further along than the US in their outreach to build grassroots support among their aging network. But as Margaret pointed out, it's critical to have the backing of the major Canadian organizations that provide those services to older persons. The United States history is not a particularly good one in terms of ratifying conventions on the rights of persons. Take the Convention on the Rights of Persons with Disabilities. While it was based on our own Americans with Disabilities Act, and while we assisted in the drafting of it, we have not yet ratified it. This did not prevent its drafting and letting it move forward, but we have not ratified it. Just a word, ratification is a legal requirement which has to be approved by the Senate. The US does not oppose many of the previous conventions, like those just mentioned, but it basically actually is a signatory, which means they agree with the intent of the convention, but they don't proceed to ratification, which does require an obligation to report to the Human Rights Commission and the committees established for each of those separate conventions. We want the USA to participate and acknowledge as a key member of the United Nations that many older persons around the globe are not as lucky as many of us here in the United States are, and that to acknowledge that the United Nations legal instrument would protect the human rights of older persons everywhere, no matter their economic or social situation. The director in the New York office of the High Commissioner on Human Rights told me in a personal meeting pre-pandemic, get the US on board for a convention and it will happen. That's a pretty strong statement, right? The Secretary General's policy brief on COVID asked the member states to accelerate efforts to draft a convention. You all on this webinar are the most influential leaders in aging. We can and we must move this forward. As Margaret reported in Canada, we have to find our key allies in government's leadership. It's complex here in the States. We have aging issues addressed in many different US departments, such as the Health and Human Services Department, our Labor Department, Department of Education, etc. We are working on trying to find the very key stakeholders and influencers in our capital. I believe our starting place is right here with educating ourselves, educating our constituents, those we serve, and our incredible provider network here in the United States. The Global Alliance for the Rights of Older Persons has wonderful resources and toolkits to use. You don't have to reinvent any wheel. I've put in the chat the website for the Global Alliance is simply rightsofolderpeople.org. But today, shortly, you'll hear even more about the open letter to support this movement. I hope your organization will consider signing on to help this effort move forward. I'm specifically hopeful that the Leadership Council of Aging Organizations and any and all of the organizations working in this space will really help to move our agenda forward. As Canada has so well demonstrated, you have to get the grassroots involved and ask the organizations who represent them to be on board. So let's stand up and be heard and take action. Thank you.
Thank you, Dr. Stewan. That was an excellent argument for our convention. Our next speaker is Dr. Jane Barrett, who's the Secretary General for the International Federation on Aging, and she's going to discuss our call to action.
And thank you very much, Kenneth, and good morning and good afternoon to everybody on the call. I think the arguments have been very clearly stated by the speakers before me, but let me be very clear about something as the Secretary General of the International Federation on Aging. Older people are being left behind. We have these stock standard phrases in SDGs about leave no person behind, and yet every single day an older person's rights are both being not protected and not respected. Every important change in our society, for the good at least, has taken place because of popular pressure, pressure from below, pressure from a great mass of people. Millions of older people are trapped in the prison of ageism and age discrimination, where their rights are not protected nor are they respected. The IFA proudly signs this open letter, this call for action. Why? Because it's the right thing to do. Because we are only powerful with one voice. Because we need at this time in our life and for the future generations of older people to stand up and move forward with a single message for a call to action. You know, in the question and answer box, I just noticed about why are some member states, some countries, you know, sitting on the fence. You know, we could still be here in another 10 years answering that question. There will always be some member states that are against, some will be pro, and some will be sitting on the fence. But today, you know, IFA has signed this pledge, the pledge for a call for action for a convention on the rights of older people, but most importantly, to join with you and millions of organisations around the world. I often talk to my staff about the $10 million. What would we do with $10 million? Today I'm saying, what would happen if 10 million organisations, 10 million people signed this open statement? Would the government stand up and take notice? The answer is yes, unequivocally yes. We cannot do it alone. We need your help to be part of this movement going forward. And this movement that is not all about us, it's about older people around the world, in every single country of the world that don't have voices as we have today. So we have pledged, I call on you to sign this open statement and use it as a vehicle to open up conversations with your decision makers, you know, at a community level, at a state level, at a national level, because we need to elevate the noise for a convention on the rights of older people. So thank you, Kenneth, and I'm sure that there's lots of questions from people today, but really there is no question to answer. Sign the pledge for the call for action and let us all join together and move forward for a convention on the rights of older people. Thank you, Ken, for the opportunity.
Thank you, Dr. Barrett. We're at the question and answer section of the program. Please put them in the question and answers box. They'll be answered by the panel, but we also have a couple of resource experts. We have Susan Summers, who's the president of the International Network for the Prevention of Elder Abuse, and we have Frances Inoden, who's the United Nations representative for Seroptimus International. So please ask the questions in the chat, and I'll direct them to the panel. So we have a couple of questions. This first question is, while we talk about the rights of older people, when do we talk about their rights to three basic needs, you know, food, clothing, and housing? I have in mind people struggling to survive in war-torn countries, in addition to famine and starvation, and also issues with respect to climate change. That'd probably be a good question to be answered maybe by Margaret Gillis and Dr. Stewan.
Sure, I'm happy to take that on. Of course, any convention on the rights of older persons would actually cover those three issues. Those are fundamental basic human rights that need to be addressed. And what the convention would do would give us a couple of off the top help. It will recognize that those rights are inherent. We know that conventions help activists and countries to move the issue forward. And another interesting piece of conventions is when they're written, it gives the right of activists to go before the Human Rights Council about every 4 to 5 years and talk about what's going on in their countries and bring forward problems like the issues just raised. So there are a number of things that would help address those issues with respect to a convention.
Thank you. We have a second question. What are some specific arguments against having a full convention for older persons? As nascent advocates in favor of a convention, we think it would be helpful to understand what the arguments are by members who are on the fence. Maybe Dr. Martha Beal, could you address that one, or anyone who wants to?
I can address that again as well if you'd like.
Absolutely.
Okay, so there are a number of arguments against. One of the largest one is that the rights of older persons are already enshrined in other UN conventions. But as Dr. Ribeiro mentioned, we know that age is not really covered by very many of them. And we really know after the pandemic and after the ageism we witness all the time that we need a convention that specifically focuses on older persons. There's also an argument that some of the soft laws like the Madrid Plan of Action on Aging, which suggests rights, covers the rights of older persons, but we know that it does not have the same teeth as a convention does. And I can tell you from my own experience in government, I was responsible for the Convention on the Rights of the Child and the government's response to that, and also for the Madrid Plan of Action on Aging. And there's a huge difference when a government has an obligation at the UN to move forward on the rights of older persons. There's a lot more teeth. It's also noted by the UN independent expert that the Madrid Plan of Action is not designed to comprehensively address protection gaps in the way that a UN convention would. There's a lot of arguments from countries that conventions are too costly. So I guess the question back is, are the rights of older persons not worth the investments that we put in other groups? I mean, it's a really basic human rights issue again. And then others have made the point that that conventions may draw attention to older persons and increases their social isolation, and that is not borne out in actual evidence. I would just mention too that on the ILC Canada website, there are one-pagers, one that talks about the positive aspects of a convention, and then one that will tell you the arguments against and how to argue against those arguments. So those are at the ilccanada.org website.
I would just add that in the United States, there's been a long-standing reluctance, and it's never voiced out loud, but a sense that we're ceding to the world government, that we need to make our own decisions for America and not be bound by world. And this has come up on other things, but we are now rejoining the Paris Climate Agreement and other international agreements. And I think it's time that we could perhaps get on board as a country for a convention on the rights of older persons.
And can I just add one more quick thing, just to add to Margaret and Martha's point? There are no good arguments against a convention. Every country has millions of older persons. We're all going to get there. And anyone who says there's a reasonable argument against a convention is not meeting the reality test of what's happening today. Just wanted to finish that. Thank you.
Thank you, everybody. We have a third question here. In your view, what are the three main obstacles to the adoption of this UN convention? What obstacles are we going to run into? I don't know if someone on the panel wants to address that.
Francis?
Francis Anoden?
I'll kick off with the first one. I think it's political will. And I would love for Francis and Susan to chime in here, because they've really been advocating on this very specific issue a very long time. So, but I just think it comes down to political will.
I can tell you that the Canadian government told us flat out that we needed to show them that there was grassroots support.
Thank you, Cynthia, for deferring to Francis and I, it's Susan. You're absolutely right. We could put an A in front of that, a lack of political will and grassroots support, and ageism, and the lack of awareness. There literally is a legitimate lack of awareness amongst peoples in both our countries. They're very well educated, very well informed. However, don't always know of all these intricate issues going on at the international level, and how this would really benefit us, benefit each of us. We all come from different countries. Our families come from all around the globe. We have connections all around the globe, people we care for, people whose rights are not protected. By supporting an international convention, we're protecting our families. We're protecting our interests in the United States. And I think that lack of awareness is a serious lack of awareness, that political leaders are not aware of the global implications. So those are my 3 A's.
I think Jane raised her hand. I think Jane, you have something to say?
Yeah, look, thanks, Kenneth. You know, I just want to put it in context just for a moment, you know, and this may, you know, when we talk about the violations of the rights of older people, you know, often we think of, you know, the worst of the worst of the worst, where older people are murdered and accept. But, you know, if we just look at the right of an older people to have screening of their eyes, the right of an older person, you know, to be vaccinated. And in our countries, some older people don't have the right to certain vaccines under, you know, the universal healthcare system. So I think we've actually got to really understand the impact of the current laws and what a convention would do. And it doesn't supersede the current laws of the country. My other point is that we've just got to look at what's happened in the 10 years or more of the Convention on the Rights of People with Disabilities. There's been remarkable progress in advancing the rights of persons with disabilities. So a convention, you know, actually can enhance and give purpose to the lives of older people. The decade is about creating an environment that enables an older person to do what they have reason to value. And that's why the IFA strongly believes that a convention is about creating this enabling environment and giving a person, not an older person, a person in their life the right to do what they have reason to value. So thanks, Kenneth, for the opportunity.
This is Frances. I think a lot of the resistance has come from countries that have laws and programs for older persons. Many of them have said, you know, we already do this, we don't need a convention. At the United Nations, when research is being carried out by the UN Secretariat, Department of Economic and Social Affairs, by the regional commissions, by the Office of the High Commissioner for Human Rights. Within all those offices, when it is considered that national action has been inadequate, then the UN should step in to consider international action. So that's from the Secretariat point of view, that yeah, not all countries are doing the right thing. And so we have to encourage countries to comply with international standards. That's from the UN perspective, and that's in terms of our work. And this happens, you know, on many, many programs. At the government level, a number of countries are also saying, and they're giving sort of false excuses. They're saying, if we sign on, oh, the procedures for reporting are so cumbersome. So there has been also a lot of administrative procedural complaints that this is going to, you know, make life more difficult for governments to comply. You know, that's obviously not an adequate reason for not having a convention. So there are governments that are pushing forward, mainly from the Latin American group. Just to give a little bit of background, Argentina in 1948, at the time of adoption of the Universal Declaration of Human Rights, had raised the issue about older persons back then, but it was considered that that was an additional point that could not at the time be included in the Universal Declaration. And so it was passed over to the Economic and Social Council to review and decide. So since that time, there has been an office in the United Nations that deals with aging issues, doing research and convening meetings, calling for world assemblies to discuss programs and policies. And then 10 years ago, Argentina took up the call again to start discussing convention. And since then, the Latin American countries have actually adopted the Inter-American Convention to protect the rights of older persons. So there does exist a regional convention to protect the rights of older persons. But of course, at the UN, we're not just concerned about regional or national action, we are concerned about international action. And as many have said, you know, the key players, the United States, Canada, I mean, Australia doesn't support, New Zealand doesn't support, many of the European countries do not support. The key players do have a role to show support, to let the process move forward to discuss. I think many people have already commented that, you know, we've had 11 sessions and we've been discussed. It's like going to a college lecture on gerontology, basically. You know, they're not discussing rights, they're discussing gerontology issues. We've discussed long-term care, we've discussed employment, we've discussed health, we've discussed violence and abuse, education, lifelong learning, all of those topics, but they still haven't discussed the need for a convention itself. So any help from NGOs at the national level, and particularly, of course, for this meeting today, from Canada and United States, it would be particularly helpful if the governments of these two countries hear from the grassroots level. And as Margaret says, you know, our people at the national level, our NGOs at the national level, our older persons at the national level, are they interested in this? Are they thinking about the rights of older persons around the world? And that's what an international convention would allow, to protect the rights of older persons around the world. Thank you.
Thank you, Frances. We have a question here. Probably Dr. Kieran Ribeiro would be a good person to answer. There should be no argument on this, but as a basic question, how variantly do nations describe an older person? Very fundamental question.
Thank you, Ken. That's a really fantastic question, because we have just been having some very interesting and important meetings with the WHO, because, and this is a complete sidebar, and I'll bring that in because it's relevant to this question, who wants to introduce old age as a diagnosis in the ICD-11, right? Which most of us who work in the human rights space feel is extremely ageistic. And to their credit, they have actually met with us on the weekend and they're willing to change it. So we're just putting together a proposal for that. But that's an interesting question, because what is an older person? We all know someone who is 90 years of age, who is functioning at the 40 or 50-year-old, you know, functional, cognitively, you know, and physically functioning at that level. On the other hand, we also know people in their 30s and 40s who look like they should have been dead a long time ago, right? So that chronological number is not the only thing. It depends on how frail you are, you know, what your biology, your genetic makeup is, what your environmental factors have done to you, etc. But generally speaking, we're talking about people who are 60 or 65 and older. And we know that if you just look at that demographic, we have 703 million people today who are over 65. And that number is going to be 1.5 billion in 2050. That's a lot of people. And if we don't protect their human rights, everyone on this call, anyone who doesn't, you know, scan their QR code and sign up for it, should really look at themselves in the mirror and ask them, am I ageist or not, by not signing this? I put that out there. Thank you.
Thank you, Karen. We have a question specifically directed at for Dr. Stewan. USA has not ratified the ERA and has not signed most UN conventions. Why should it sign the rights of older persons? What has changed politically? Is basically the question. It's obvious.
Unmute. Well, we haven't ratified the CEDAW, the Convention on the Elimination of Discrimination Against Women either. Basically, in addition to ageism, we're talking sexism and all of the ugly isms that it entails. And so I think in addition to, I think there's been some progress, some changes, certainly, but it again comes down to, look who's making up. I mean, there's gains in our elected officials, but it still comes down to, there's a very interesting article in the New York Times today about women. And, you know, we always talk about the glass ceiling and why they don't progress, but it's the very little innuendos, it's the basic day-to-day sexism that occurs in the workplace, that, you know, women just don't get promoted equally as men and reach the top. So I don't think there's any difference. The difference here is we're talking about all older people, and hopefully it isn't just a woman's issue, it's everybody's issue, and it's a lifetime issue. We age from the beginning of when we're born, and that's where I think the whole intergenerational movement is one that we really need to address, because we have to gain better understanding across the generations. Carol, you'll remember back in the 70s when we had the whole campaign against, you know, the greedy geezers and Social Security income and all of that. You know, there has to be a better communication about what Social Security means to people and its livelihood. Just like in this case, why do we need it? Well, we have some laws and protections here in the States. However, how successful has the age discrimination law been in really protecting older workers? You know? But I think it all starts with each one of us saying, just because it hasn't been done doesn't mean we can't move the mountain.
Agreed.
Kenneth, could I just make a brief comment? And, you know, I think we need to talk about, you know, this point in time too. This point in time is the beginning of the decade. This point in time is the first evidence-based report on ageism. So this point in time also constitutes member states within the WHO talking about the rights of older people within the decade. And so I think it's very important that, you know, we capitalise and have the voices of civil society, you know, at the table. And while we come into this discussion, not all of us with the same information, there is a clear intent to connect, to collaborate, to mobilise knowledge and to mobilise action. And all of the experts on the call today, and, you know, clearly many who have been listening, you know, it's about how do we build and coalesce and strengthen the conversation so we have single case messages, as Margaret talked about, and move forward. Thanks, Kenneth.
Margaret, you raised your hand, I noticed. Oh, okay. Well, sorry.
Yes, it's Frances. I just want to say that even though the United States has not ratified the Convention on the Elimination of Discrimination Against Women, it has signed it. It does have laws and it does have policies. It has not stopped the convention from moving forward. I think at this point in time, what we need to do is to encourage NGOs in Canada and United States to call for action in terms of the two countries being global players. It's not just about national policy, it's about international policy. I often think if I choose to live in Malawi tomorrow, shouldn't my rights as an American citizen be protected there as well? If I choose to live in India, should my rights not be protected as an older person? So the calling of NGOs to sign on and to take action is to make sure that everyone's rights are protected no matter where they are. And the big players at the UN can ensure that happens. Getting to ratify it is another issue, but getting the conversation started and agreement on let's start working on a convention, that's a huge step already. So I think that's what we're asking Canada, the NGOs in Canada and United States, is to encourage our governments to participate in the discussions. It's not even negotiations at this point, to participate in the discussions and to move forward on talking about drafting the elements of what could be in a convention, and not to stop that process. They don't need to ratify at the end. It takes a lot of effort. I mean, I don't know whether in America people remember Robert Dole, you know, at an age of over 90, going into the Senate to try and persuade the US Senate to ratify the convention, and he was not successful. But that does not mean the United States is opposed, right? It's the purpose is for an international. We're not saying US has to have a convention. We're saying the international community should have a convention.
Thank you. Thank you for that answer. That was very motivating. So we're at the end of our program today. I'd like to just to reiterate, please scan the QR code, and we'd really like all your organizations to sign our call. And I think this is a unique moment at the start of Decade of Healthy Aging. It's a unique time, especially after the pandemic, which I think showed the amplification of all these issues. If we get as many organizations in the US and Canada involved to help us make the case, I think we can get a convention. And the IAGG, the International Association of Gerontology and Geriatrics, has already lent their support. I'd like to thank all my panelists and all our resource experts. They were excellent. Thank you for the International Federation of Aging for hosting us today. Thanks greatly to Anna Stauber and Ashley Patrick for wrangling all the chats and for all their help getting this together. And I'd like to thank all the attendees, and please, please sign our call for action. I think this is our moment. And thank you for attending.